Hi, everyone. Welcome to our webinar. On behalf of OSP, I would like to welcome you to the second episode of our webinar series, Healthcare Leadership Insights. I'm your host, Stacy Hurt, and I am joined by, as I just said on Twitter, the incomparable Jane Sarasohn Kahn. This is truly a pleasure. I'm just gonna, I'm always real with you. Jane is asked to do 1,000 of these, and she is joining us today, and I'm so grateful for that. You all know Jane. I mean, she is a health economist, a trend weaver, a blogger, an author, and if you haven't already, you need to check out her blog, Health Populi. So Jane, welcome. 31 years of experience in health economics. You have seen it all. Now in this atmosphere, you're continuing to see it all.
Oh, man.
We're just going to go ahead and dig in. Just one piece of housekeeping for our audience today. We are limited to a half an hour today. So please, if you do have questions, let's go ahead and drop them in the chat. At the end, I am going to provide you with my email. Please send us your questions. We will get you an answer. But Jane, how are you doing today?
I'm so good, and I'm so delighted to see you there in Pittsburgh.
Here I am. I just visited Jane's alma mater, University of Michigan, with my now senior son. This Penn Stater was impressed. I'm getting a little bit of heat for it, but I see.
I'm lobbying hard on the Go Blue Wolverine end of things. So keep calling me. He can call me. I got your back.
I appreciate that so much. Go Blue. I'll even get out a Go Blue. Oh, that hurt. But hey, Jane, let's get, ooh, that hurt. Let's dig into it. So much going on, so much to cover. So right now, the entire world is continuing to face the COVID-19 pandemic. And I know that the pandemic itself has been a driving factor of the rise of digital technology. It's impacted me directly as a patient and caregiver. What I would like to know is during such trying times, how has digital health technology transformed the economy of the whole health sector?
Yeah. So, digital was everything in the pandemic. And if you couldn't digitally transform yourself and your family and your home, you were out of luck. And so before we talk about the health economy, we have to talk about the bigger macro economy. So COVID hits in early 2020, sorry. And all of a sudden, work from home becomes de rigueur, common for everybody who could work from home, school from home, do your faith business from home, fitness at home, and even make sourdough bread and show them off on Instagram. But you couldn't do any of that if you weren't connected. So this digital transformation of organizations that we talk about in our work lives really happened to us as individuals. People who could digitally transform did. People who were really resistant to it did. So Zoom became a noun and a verb, and people were Zooming early on then, March, April, in that Holy Week of Easter and Passover, and older people got online and new digital front doors to socializing with grandchildren and friends, playing bridge, and even we've been going to Zoom funerals. I just had one of a dear cousin in Michigan where I couldn't get to the funeral because it was graveside with 9 people. So we've been Zooming for everything, but those of us who couldn't, didn't. And so what happened in the larger economy was we had people who did well economically, who could work and go to school, and those who could not. And that exacerbated trends that were already not pretty in America for health disparities. So we talk about the health economy now, and fast forward to just yesterday, new report from Kaufman Hall, who are health financial experts who've been tracking hospital and physician practice economics. And up until a few months ago, we saw a little bit of improvement this year, month by month, February, March, April. And yesterday's August 2021 report from Kaufman Hall shows a real change due to the Delta variant exacerbating the hospital margins, or the lowering of hospital margins in the US. so that they forecast a couple months ago, half of US hospitals would have negative margins by December 2021, the end of this year. Still half of US hospitals would be in the red. And physician economics too have been hard hit in a different way. Yes, some patients not showing up, but the cost of labor has gone up because a lot of people aren't coming back to work. And there we point to the SHE session, the negative impact of women's home economics, women's personal economics, where people like you, who are a caregiver to your kids, and a wife and a homemaker and all that, plus all the work that you do in your professional life, women have been hard hit in the pandemic. So that's something that I've been asked to look at a lot lately in terms of scenario planning. Will women go back to work, or is this really the great resignation where women just will say, to heck with it, I've had a change of heart? And so we're really seeing in the labor markets now challenges as we think about nursing and caregiving, and nurses already hard hit. And we hear this in the pandemic and even before with burnout. But I think a lot of people who aren't getting vaccinated don't realize the impact they're having on the health system in terms of worsening physician and nurse burnout, and really having a terrible impact on the supply side of healthcare. Because as we saw the doctors coming out of the hospital in Florida and entering the hospital in Florida a couple of days ago, it was either Tallahassee or Tampa, I can't remember, but it was one of the T towns in Florida, saying, look, people, get vaccinated because there are no beds here if you have a heart attack. So, or for your kids who get sick with any number of things. And so we have to start connecting the dots and getting smart about what I do impacts you, impacts my community, impacts the world. And that is the hopeful thing, is that we are all connected. So if you do the right thing, you're doing good, and it's a virtuous cycle, versus if you don't do the right thing, we'll be in this endemically for, into 2022 toward 2023. So yeah, the impacts are of the personal economies of the household, particularly on women in this recession that we've been through or we're going through. And then the larger health system impacts, terribly tough on hospitals and on physician practices as well.
Well, you talked about if you have a heart attack. That's what I'm seeing in the cancer world, is patients who need, we're back to where we were at the beginning, where patients needing life-saving treatments and surgeries can't get beds, delaying treatments, delaying surgery. And that ripple effect, as you said, it's far felt across the entire ecosystem.
And the lack of going for preventive maintenance last year, women who didn't go for mammograms, men for prostate exams, any number of tests that were avoided, colonoscopies, we're now going to see what health economists call excess deaths for breast cancer, prostate cancer, colon cancer, in 2023. We're expecting thousands of people to die because they will have been diagnosed later or not diagnosed at all. So this is the sober world that I have to live in part of the time, which is the epidemiology, the statistics that are so morbid, but that we can impact with behavioral economics and making good choices. So again, we have to have hope.
Yeah. No, it's all about hope and looking forward. And speaking of hope and looking forward, I want to shift over to talking about health equity, which is something that we talk about often online. So I want to ask, how can digital transformation in healthcare boost health equity while supporting providers' financial health?
So one of the important lessons of the pandemic in terms of provider economics is that those providers who had already started to take on value-based payment, bundled payment, pay for performance, quality outcomes, all the flavors of value-based payment, did better financially in the pandemic than those whose incomes were based largely on volume. That is, you come in, I get paid. I do an MRI, I get paid. Well, we didn't go in for healthcare in terms of brick and mortar in physical life. So those who could pivot to telehealth, virtual care, remote health monitoring, any number of things, keeping people safe at home or in their community closer to home, in pharmacies, in community health settings that were safe to go to, fared quite well financially. And we see that in the Kaufman Hall data, looking at the hospitals and other data as well. So value, as it turns out, is a good thing to take on in terms of risk managing your future finances. When we have that value-based mantra and ethos in terms of our holy grail of payment and delivery, organizing that way, we're incentivized to keep people healthy at home when we can, to use new technologies like connecting people via remote monitoring. Now, the limiting factor there is connectivity. So we talk about health equity, our newest social determinant of health, which isn't so new for people like me who've been saying this for a while, but the newest SDOH is connectivity, broadband, Wi-Fi. And Abner Mason from Consejo Sano and I have a very loving relationship online because we're like, two people, sister and bro from another mother. And we know that broadband is a social determinant of health. And we've seen this in the pandemic. So health equity isn't necessarily just about medical care and an on-ramp to health insurance and primary care, which it is. Primary care rocks for health equity. Invest more upstream, and then you don't spend as much downstream. This is easy. It's easy to figure out. But without connectivity, we can't get through that digital front door. So we need that as a precursor, a sine qua non, as we say in Latin, to get to health equity. And when we have that, then we must address other aspects that connect the dots to well-being, clean air, clean water, that primary care on-ramp, food security, which was highly compromised in the pandemic. Some of you have seen that iconic photo that I can't get out of my head of the cars lined up at the San Antonio Food Bank for miles, people waiting who never needed to take advantage of a food pantry did in the pandemic, particularly in the early weeks of it. People who couldn't, work from home and get a paycheck. So yeah, health equity is now pretty much exposed in the pandemic. And we see that in the numbers of mortality and morbidity, particularly among people of color in America. So this is the old new news. Wasn't news to a lot of public health people, but by last April of 2020, the CDC data came out showing clearly that Black and Latinx people were much more likely to be exposed and then to die from the coronavirus.
Well, I mean, these are all the same conversations you and I are on about the digital divide, and these stories continue to be real of people trying to get on EHRs and trying to get on patient portals, accessing broadband in a coffee shop or a library. That's real. And this leads into our next question about mental health. And if you're accessing, you have to access these private medical records in a very public place, to talk about very sensitive issues. I mean, that's a real problem. And with that, Jane, let me go into my next question. How does mental health play into boosting the effectiveness of digital health adoption? And what does that have to do with financial health?
Yeah, this is all bound up together. We need to understand these many factors that contribute to overall holistic well-being. Back in 2010, I worked with Edelman on one of the early health engagement barometers. And we asked people, US consumers and consumers globally, the US data showed that Americans really highly value physical health, mental and emotional health, their physical appearance, interestingly, and financial health almost equally. It goes from sort of 90% to financial health was 8 in 10 people said that's part of my overall health. So we get that now, especially the pandemic enforces all of that. So looking at the mental health aspects. You know, before 2020, we had a mental health epidemic. I heard folks on one of the major morning talk shows, the 6 a.m. one, I get up early, talking about this morning with respect to kids and mental health going back to school, and new old workflows, life flows for kids in wearing masks, distancing, whatever. But mental health has been with us, mental health challenges, you know, since before the pandemic. But again, as with many things, the pandemic exacerbated mental health issues and behavioral health issues. We have to talk about both at the same time, in terms of, you know, in the quarantine, people feeling lonely, disconnected, and especially people who couldn't connect via virtual methods, virtual platforms. What happens with mental health in the pandemic is, and really in healthcare in general, is most people managing chronic conditions at some point have a comorbid diagnosis of anxiety or depression. It's natural. It sucks to be diagnosed with diabetes, asthma, congestive heart failure. I saw this with my dad, who got CHF at 84, still working, still driving, still enjoying traveling with my stepmom, full life, full of life and loving life. And then CHF, and boom. He got so down, and my dad was like Mr. Can Do, you know, Mr. Positive. So I mean, this impacts people old to young, and those in the middle, in the sandwich generation, like you and me. What happens with that comorbidity of mental health is you can't deal with the chronic condition very well, whether we're looking at acute cancer or chronic conditions like diabetes, unless we also deal at the same time, walk and chew gum, with the mental health issues, especially anxiety and depression, low to mid range. But that complicates taking care of the chronic condition, adds costs when we don't deal with, people can't go back to work. Then you have the financial hit. You can't go back to work. You're not productive, you feel like life sucks, your sex life suffers, everything goes dark. And so financial health, mental health, physical health, all bound up together. And it's so important we deal with all of that. Then behavioral health is hit. People drinking more alcohol who did so, not everybody did, but the Nielsen data in terms of retail sales show that folks who bought more alcohol in the pandemic but supersize. So you could go on e-commerce, order your vodka, your gin, whatever, and it was cheaper to buy the big size in your experience from going to a packaged liquor store versus buying online. Oh, it's such a deal. Meanwhile, drinking more. People who wanted to quit smoking couldn't, the stress. People who were sadly having violence in their homes, either as a victim or somebody exacting violence. It was a risk, a greater risk in the pandemic because people were shut in. That was a really tough situation. There's some data coming out about that in real time and even now. So that's the behavioral health impacts of all this. So we need to address health holistically. We've learned, we knew that before, we know it even more now. And we're seeing now employer health plans looking to the 2022 period, and Medicare Advantage looking increasingly at investing in mental health, behavioral health programs. And that's going to be really important for go back to work programs, for employers to address. And then, as I said, Medicare for people who are getting older. And for people in the middle who aren't working, we hope state Medicaid programs will really bundle mental health with primary care, which would be a great thing to do.
Well, again, I mean, just back to your point, I mean, it all goes together. And, you know, what we've seen in the past with health plans, you know, as people are jumping jobs, and my problem today is not my problem tomorrow. So where's the incentive to keep this employee healthy?
Yeah, the churn, right.
Yeah, because they're just going to be with a different plan. But really the long game, as you said, is the holistic view of the patient, and that carries over to the entire ecosystem, you know, of overall cost, certainly. Next question I want to tee up for you, Jane, is let's talk about the big tech stakeholders, and how are big tech stakeholders playing a role in healthcare's financial ecosystem? Let's talk about that.
Well, man, they've been in the news lately, haven't they been? Google and Apple and Amazon. Oh my.
Big plays, big moves.
Honey, that's why we don't sleep. We keep getting those Google alerts and news
Seriously.
items. Seriously. So, right. It's for a while we were looking at big tech as a potential savior of healthcare. There's a strategy and study from PwC from a while back which I used to quote in my speeches, saying most Americans equally value the role of technology companies and health providers in the future of healthcare. It was split pretty equally I think it was 40% and 40% of consumers were looking at the future of health to be saved by big tech versus your provider. And when I go to state hospital associations to talk to hospital execs, they'd say, what? Tech in my business? So now everybody's working with tech, of course, and Google reorganizing. And Google's not going away. So let's get real. The press has had a lot of fun, and certain haters gotta hate people, But no, Google is still in healthcare because the Google Cloud in life sciences and health is a big deal. And so is AWS, Amazon Web Services, and so is Microsoft Azure. So I point to the cloud when you ask about big tech, is sort of the big thing that we should really be excited about. We have data coming from everywhere, and we want data, a lot of good data. The volume of data then feeds the AI engine, which can then give us more personalized care and instructions. So we take a cancer drug that's better suited to us, or we even get good personalized coaching to get off our seat and go for a walk, like my watch gives me. So, but all that data is important. The data in the claim, the data in the pharmacy, the data from my YMCA or my personally generated data. And I got a few devices on right now that are collecting things about me. So to align my wellness, because that's important for me. So that data need to go somewhere. Those data points need to go somewhere. And we have a lack of interoperability, which we heard about at HIMSS again a couple of weeks ago. That hasn't gone away. But increasingly, we are able to capture data and corral it, mash it up, analyze it. And this is the opportunity. This is a good thing. And we need big tech to help scale that, because you can't just do that, on site with a big computer processor. And we want data to come in from real world evidence, patient generated, and again, the medical claims and pharmacy claims stuff. And even our retail receipts are really useful. But you have all that data, and now we need regulation to come in to make sure our data are used for good and used for our health. So I've been talking a lot because I'm split my time between the EU and Brussels and my Philadelphia home. And so with my Italian passport, I am also a European in addition to being American. So I have two identities. And when I'm in Europe, I'm a health citizen because I'm covered by healthcare as a civil right, but I'm also covered by the GDPR for my health data protection. HIPAA doesn't do what the GDPR is. The California privacy legislation, CCPA, is much more akin to the GDPR, with the power to forget me, giving me the power to tell you, forget about me or not, and other aspects. But we need data to be used for good, for health, in the context in which we share it from here or any number of places. And so that, I think, that's going to be a challenge for the US. We've got a lot of priorities right now, but patient protection for privacy and our ability to control that data has to be kept in the front of our minds. And my friend Johan Sonnen just sent me something about ownyourdata.org. Do I have it? Yeah. Johan at Go Info Studios. Hard to see with my thing. Ownyourhealthdata.org. Calling out my good friend Johan Sonnen, who is a data visual genius. And so his group's working on that. And I've been very much involved with him, thinking about owning, controlling, maybe not owning our data because it's everywhere, but controlling and auditing it.
Yeah, I'm all for that. Yeah, I always say, if you're going to, that's one of my big stopping points is, if you're going to collect data on me, you better have full transparency, where it's going, what it's being used for. for patient data. Jane, I got one last question for you, and it's something that you write about a lot and you speak about a lot, and that is the quadruple aim. So what are the prospects for digital health in addressing the quadruple aim? That is bolstering population health outcomes, enhancing the healthcare experience, lowering per capita costs, and finally, ensuring providers' well-being.
So Dr. Donald Berwick, who was the father of the triple aim at the Institute for Healthcare Improvement, he's one of my personal heroes. He coined last year, after George Floyd was killed, in a JAMA essay, Dr. Berwick wrote about the moral determinants of health. So we knew what the social determinants were, but now we in healthcare have an obligation to really call them out as moral determinants, because it is what it is. Okay, so we think about how do we address the quadruple aim, and on any given day I would look at one of those four legs of the stool and focus on one, as on that day what's keeping me up at night. And the stool, the fourth leg of that stool is provider clinician well-being, and that's where I have to come down on it today. Look, we're going to manage costs eventually, because we're going to have to. We're pretty broke, actually. So we're going to have to get broadband everywhere and do more virtually and in lower cost settings. We're going to have to design. So this is where it comes in. We think about the enchanting experience for patients, also for clinicians. So the EHR implementations spawned by the HITECH Act really was a major burnout factor for many physician practices, who took a lot of time away from patient eye contact to look on a screen instead of the using voice technology, which we're getting better at now. But in the earlier days, that was a burnout factor. We need to bring design, user-centered and service design ethos and health equity by design into how we create, build, imagine, implement health IT overall. That then will help streamline workflows for clinicians from the technology point of view, the workflow point of view with patients in hospitals, for nurses and doctors. What those design processes and the best health vendors can't design out of the system is systemic racism, is bias in algorithms, is third parties who want to exploit data beyond health and healthcare. And so that's where public policy comes in. So the quadruple aim is our holy grail, but we cannot put all the pressure on the health system to solve all these problems, because social determinants are part of larger biases in society, resource allocations that come out of Washington and state houses. And so the more we call these out and use our voting power to vote for policies that bake health in them, and we end with climate change on that, that's really important. So again, one of my jobs, if I've raised a little consciousness about connecting the dots between clean air and clean water and loving thy neighbor and getting vaccinated, then I've done my job with you today. And that will help build the value-based, empathetic, lower cost health system. I really believe that.
Well, you're preaching to the choir, and as you know, but I think the best part about today's discussion for me as a patient, as a caregiver, is that the things that I'm out there talking about and I'm on social media passionate about believing in from a level, the level that I'm at, are aligned with the same things that you're seeing and you're believing in and you're out there for. So it just really inspires me, Jane, to keep going and keep talking about it and keep moving everybody in the right direction. And as I said this morning, pushing the boulder for public health, public and population health. And I'm 100% with you that it is really, it's whole person care. It's skating to where the puck is, as you always say, and putting the pieces together for everybody. And so I can't thank you enough. Everyone, I just dropped my email in the chat. I know we're not going to have time for a Q&A today, but please direct your questions to Stacy Hurd at osplabs.com. We will follow up with you, get you an answer. Jane, I don't even know what to say other than thank you so much. Thank you for the work that you do out there, making the world a better place. I'm honored to know you. And like I said, it really inspires me and gives me confidence, just getting really active and ramped up in this space that I'm on point with the things that I'm talking about.
We can do it. We're in it together. And if we just, go together, we go farther, right? And so, I believe that. So I love working with you, collaborating with you and our whole group of loving patient advocates and others. So let's make this happen. That we have an opportunity now to really lead with love and being really smart about it. And boy, I know so many smart people like you who are out there. So let's just keep going and stay resilient and positive.
That's it. Get vaccinated, everybody. Check out healthpopuli.com on behalf of OSP Labs. Thank you for joining us today. Stay safe and stay well. All right. Thank you so much.
Thanks.
Bye.